Hello dear learners, welcome you to this presentation on Drug Information Services and Drug Information Bulletin. Learning outcomes of this presentation are: after completion of the presentation, you will be able to understand the drug information services in the hospital. You will be able to know the various sources of drug information. Also, you will be able to remember the concept of drug information bulletin. Roadmap of this presentation: first we will go for the introduction, then we will see utility of drug information services. Afterwards, we will go for sources of drug information. At last, we will see drug information bulletin. So here we will see the introduction of the drug information services. So drug information is the facility of oral or a written information. So here the information are related to the drugs which is provided to the healthcare members in oral or in the written format. Also, advice on drug and therapy in a response to demand from healthcare professionals, organizations, committees, patients, or an individual of the public. So here the information is given to the healthcare professionals, organizations, committees, patient, or and the individual person. So this information which is given either oral or a written format. So drug information services, that is DIS, explains activity undertaken by the pharmacist in providing information to optimize rational use of drug. So this particular information which is given by the pharmacist in providing information to optimize rational use of drugs. So here for this purpose, here first pharmacist must gather the information related to the drugs either for the new formulation or the old. So this information which is provided to a rational use of that particular drug and safe use of that particular drug. So here for this purpose, well organized pharmacy library plays an important role to provide the information on drugs. So in the hospital pharmacy, there will be a separate section for the library. So the information which is gathered in the library and sort out with the authenticate one. And then this particular information which is provided to the needy one or the health professionals as well as to the organization and the patients. So here the pharmacist answer the query through drug information center. So here pharmacist is an head of this particular drug information center. So pharmacist will gather all the authenticate information. Also he will sort out that particular authenticate and required information in the library. Then the users will use it to get the knowledge about that particular drug formulations. So here pharmacist is the right person to head the drug information center because he knows about all the information related to the drugs. So why pharmacist is the head of drug information services? Because pharmacist is interlinked between the doctors, nurses as well as the patient. So pharmacist is a member of the Pharmacy and Therapeutic Committee. He knows the sources of drug information. Also, pharmacist has an ability to evaluate the literature critically. Also, pharmacist has a knowledge to handle the computer, and he knows the role of other staff member in the hospital. So because of these reasons, here pharmacist is a right person to head the DIC. So here we will see some common issues like drug use problems. Also here irrational and over prescribing is a common, and the antibiotic resistance. So such a problems are as a result of a variety of economic, social, medical and regulatory factors. Also these problems is due to the lack of awareness about drug information center, availability of a tremendous formulation in the market. The national drug policy is industry oriented rather than health oriented. Lack of awareness about the drugs rational use among the doctors and pharmacists, and increasing sale of a drug by OTC, that is over the counter, and some illegal use of the drugs. So these are the some common issues and the reasons about the drug use problem, and overprescribing is an most common. Let's move forward. Here we'll see the utility of drug information services. So the first, this drug information services present a specific and vital information to the doctors for the drug therapy. So it gives the information on new drugs as well as the old drug to the doctors. So it helps the doctor at the time of prescribing the drug to the patient. Also, it guides on pharmacy research project, education programs, and other pharmacy services such as drug distribution, storage of the drug, as well as at the time of handling of the drug. Also, it provides a regular periodic amendment on drug to the medical practitioners. So here is a necessary to update that particular drug information services with new information. So amendment should be there. So this drug information services periodically update the information in the drug bank or in the drug information services. Also, it provides a research finding to the physician, and it produces comparative information to the doctor that helps him to evaluate potential of new drug for the same treatment. So the newer formulation is coming in the market, so the information related to that particular formulations here provided to the doctors by drug information services. So these are the some utilities of drug information services. Let's move forward. Here we will see the sources of drug information, from which sources the authenticate information will get, or the information of drug will be got. So here the function of PTC is to maintain a library and documentation services. So here the PTC is responsible to provide facilities such as library in the pharmacy section. So here pharmacist will gather the information, and this information will be sorted with the authenticate one. So here the librarian has to collect and sort out all the vital information available with different sources to furnish it to the hospital staff. So here we will see some sources of drug information, like some primary sources and these secondary sources. So let's see in a detail. So in the primary sources, the information on the drugs which is obtained from basic researches and the developments. So in the primary sources, some research and development will help to get the information. Also, the information available on internet, website, CD and ROM, etc. That is CD, that is compact disc, and ROM is a read-only memory. So here the information which is already stored in a CD format or ROM format. So whenever it required or necessary, you can use this particular CD or ROM to retrieve the information. So here the internet is an basic source to get all types of information. So you just put in the browser whatever you are required and just click. So you'll get the information. All types of information will be gathered through the internet source. So by using this website, some authenticate website, so once you put in whatever you required, so just click. So on the one click you will get the information, so much information you will get on the one click. So this is the primary source. So the information will be gathered through internet, website, CD or the ROM source. Here we will see the secondary sources. So the information available in the form of abstract, journals, periodicals, textbooks, reference and official books like pharmacopoeias. So you can see in this picture, so here Indian Pharmacopoeia 2018. So by using this official book you will get the drug information. Also from the national formularies you will get the information. Also by using some journals like International Journal of Clinical Pharmacy, and also by using some textbooks and the reference book. So let's see some journals and periodicals like American Journal of Hospital Pharmacy, the Indian Journal of Hospital Pharmacy, also from the Journal of American Medical Association and the Journal of Clinical Pharmacology. So by using this journal you will get the information of the drugs. Also by using some textbooks like Hospital Pharmacy, Clinical Toxicology, Pharmacological Basis of Therapeutics. So by using some textbook, here the authentic information will be gathered, so it helps to know the drug and its formulation. Also from some official books like pharmacopoeias, the Indian Pharmacopoeia, that is IP, United States of Pharmacopoeia, that is USP, British Pharmacopoeia, that is BP, British Pharmaceutical Codex, that is BPC. So by using these official books you will get the information on the drugs. Also, by using some reference books like Remington Pharmaceutical Sciences, Merck Index, Winthrop Hematology, you will get the information. Also, by using some formularies like National Formulary of India, National Formulary of America, British National Formulary. So by using some textbooks, some official book, a reference book, you will get the information. So you just remember here, so the information on a drug which will be get by using some internet website source, that is primary sources, and by using some textbook pharmacopoeia, that is official books, and some reference book and the formulary. So it comes from, or it comes in the secondary sources. So these are the some sources of the drug information. So let's move forward. Here we'll see the drug information bulletin, that is DIB. So here the DIC may publish a journal or periodical or any booklet about the current or amended information on drugs, various technical aspects, and modernization of hospital practices for all the health professionals. So this published booklet or the journal is called as the drug information bulletin. So you just remember here the published booklet which have the information on current drugs, or you can say that the amended information on the drugs called as the drug information bulletin. So this is an published booklet or any journal which gives the information on current aspect of the drugs. So here we'll see the some advantages of a drug information bulletin. So this drug information bulletin provides current information to physician, pharmacist, and the nursing staff. So here this drug information bulletin educate the physician, pharmacist, and nursing staff on the recent advancement of the drug. Also, it acts the link between drug information services and health professionals. So it acts as a link. Also, it helps the hospital staff regarding researches and clinical practices. So by using this information, the health professional members can go for the research purpose. So it helps to the researcher to get the information or the current information on the drugs. So by using this information or this drug information bulletin helps to find some research or do some researches. So you can see in this picture, this is a drug information bulletin which is published by Indian Pharmaceutical Association, that is IPC. Also in this picture you can see the drug information bulletin. So by using this drug information bulletin, here the information on current aspect on the drugs will be gathered or will be used for providing better services to the patient. If the physician, pharmacist, and nurses knows the information on the drug, so definitely it will help to provide better services to the patient. So this is about the drug information bulletin. So in this presentation we have seen the drug information services and the Drug Information Bulletin. If you have any question, you can drop your question or query on my WhatsApp number or on my email ID. At last, thank you very much for patient listening. Thank you.